Derma in the Ridge Medical Practice. Megan speaking.
Well, I'm so glad you came today, because any kind of pressure in the back of the eye can lead to permanent sight loss.
I have a lump here.
How long have you had it for?
I'd like to blame Brexit, but I've had it about 15 years.
All right.
That might be a separate problem.
Blimey, how many problems have we got?
Oh, you've only got 10 minutes. You know, use them wisely.
Hello. She loves her Auntie Debbie, don't you? Yes, she does.
I don't feel that on.
You need to be very clear on this, Mark.
Yeah.
If your breathing is off, that means I'm going to have to send you to hospital.
Hi, Miss Carver. Come in, how are you doing?
Yeah, not bad.
Come and take a seat, Jake. Nice to see you. Right, I'm Dr. Khan. How can I help?
I've got this bad cough. I've been coughing up sort of phlegm sort of thing for a while.
OK.
But I moved out of a house yesterday, so there's been things burning in the garden, there's been bleach all around, everything like that.
Right, OK.
And since last night, I've basically just been coughing up blood constantly.
Right,
so
OK, yeah.
111 have told me I have to come straight in.
I think 111 are right, OK. Right, so you said you've had the cough for a while.
It's been about a week and a half.
Yeah, yeah. And prior to yesterday or today with the blood, what was coming up with it?
It was just phlegm. I smoke, so that comes a lot.
Yeah.
But obviously, blood's a different thing. So.
Yeah, of course. OK. You mentioned some slightly worrying things, which is things have been burning in the garden and there's been chemicals around as well. Tell me about the blood that's been coming up. What's that been like?
It was like thick and gumpy. It's horrible, yeah. It's like you get a mixture of like the phlegm sort of thing in the blood.
OK.
But yeah, it's not pretty.
Yeah. Bright red or dark?
It's quite bright, to be fair.
Yeah.
Yeah.
And is it mixed in with the phlegm or is it pure blood that's coming up?
A bit of both.
And it's every time you cough?
Yeah, pretty much, yeah.
Ariana, she's 7 months old now.
Yes.
Hello. Do you like standing up now? Right, come on then, what's the problem?
OK, so her eczema started to flare up again.
Did it settle?
It settled, but it was still sort of a little bit dry, so I've kept up with the creams.
Yeah.
Back of her neck and under her chin, that's never really cleared up.
Right.
And she's itching her eyes quite a lot.
At this age, they develop habits as well.
Yeah.
So if they start pulling their ears and they like it, or they're rubbing their eyes and they like it, they carry on doing it. We'll have a look at her anyway.
OK.
I'll do a temperature. Sorry, love, you do. Dad's blind.
Yeah, Dad's blind.
Sometimes we forget to tell people because we know you so well.
Yeah, yeah.
So her temperature's normal, so I need to listen to her chest.
Yes, that's fine.
You're not bothered, are you? You're not bothered. Gorgeous girl. I'm just pulling her tights down and I'm just opening her nappy.
Yeah.
There you go. So sit her back on your knee, Dad.
OK.
We'll have a listen to her chest.
It's non-stop talking now, but she's gone quiet today with you guys.
Are you shy today? That's fine. Right, let's have a look at this skin. If you lean it, lay her back, but keep her on you. That's great. So tell me what you worried, where you worried about.
It was more on her tummy, and I think there's a little bit left down there, unless it's gone not that bad today, actually.
This skin here is absolutely beautiful, and so you are doing a really, really good job. Look at her face. Are you going to do a bit of this now? A bit of kicking. If a baby has got baby eczema, it doesn't mean that she's going to have eczema forever, but it does mean that her skin's going to be more sensitive. So she'll have good days and bad days. So like you say, it's better today. Yeah, is that good? Hooray! Hooray! Yeah! The treatment is moisturise, moisturise, moisturise. Because if you get a dry skin and a bit of a sore area, that's when your germs get in and it flares up and it gets infected. Keep putting that moisturiser on 4 times a day. Use it instead of soap. Do all that. Her skin will stay like this. I'm absolutely delighted with it.
That's fine.
She's beautiful. She loves her Auntie Debbie.
She
Don't
does.
you? Yeah, she does.
Everyone's got nicknames for me, it's amazing.
Loads of them.
Beth and Lorraine call me Ebbers.
Ebbers.
Assad and Ruth call me Ebony. And My mum calls me Ebby, Ebs, idiot.
Idiot.
I love talking to you on a Monday. You always cheer me up.
Aww. Cheer everyone up.
If you get any phlegm now,
Yeah.
let me know, because I'd like a sample of it. Yeah,
Which one?
Which you choose. There you go. So your oxygen levels are good, 99%. Your pulse is nice as well. Let's have a think about things, because you've had this cough for a week and a half. Now you're coughing up blood. Your chest sounds reasonably clear when I'm having a listen to it. It's not obviously an infection when I'm having a listen there.
All right.
But that doesn't give us an idea of what is going on.
OK.
One thing that makes you cough up blood, not that rare in Bradford, to be fair, but TB, tuberculosis.
OK.
Sounds like a bit of an old disease, but we know that with an influx of people from different backgrounds in Bradford, it comes and goes in phases. There are other more worrying things. I don't think we need to worry about anything like lung cancer with you because of your age, but you do have a smoking history.
OK.
And I'd like to send you for a chest X-ray to see what might be going on there.
Yeah.
I'm not convinced that this is just a simple chest infection and you're coughing forcefully and you're bringing up some blood.
Yeah.
It just sounds a bit iffy. And with the history of you having some chemical and fire exposure as well, I just want to have a closer look at some of the glands inside of your chest and the lungs as well.
OK.
Do you think you'd be able to go for a chest X-ray this morning?
Yeah.
Yeah?
That's fine.
If you can go today, I should get the result back by about Thursday time. Why don't I phone you with the results and then we can go
that's
through
fine.
it there. All right. Nice to see you, mate.
Nice to see you.
Cheers. See you later.
See you later.
Bye.
Hiya.
Hello.
What's your name?
Matt.
What is it that you want to speak to the doctor about today?
Recurring backache, and I've got pins and needles in my arms and my back and my legs.
Okay.
Hiya, come on in. Dr. Harris, hi.
Hello.
Hi, Kim. Sit down. OK, so today it's vasectomy.
Yeah.
And the...
Sorry. I think this is so
Why is it
funny.
women that find it funny?
I seem to, don't
Because
they?
I went through labour and everything like that.
That's
so.
usually is. It's sort of like that payback type thing, yeah. I'm just going to whiz through some of the final details. So it's irreversible. You don't want to father any more children.
No, 4's enough.
OK. 4 is enough, yeah. I've got 4 and 4's plenty. So what we're going to do today...
I'm getting too much dry out of there.
You are, aren't you? And we examine you to separate the sperm cord from the rest of the cord, the arteries, the veins. So that's why we don't expect any complications related to your testicles.
That's fine.
Yeah. You might feel a bit of dragging in the groin, and that's so that we can operate through a little nick in the midline. We then wash you down, do the same again. When we get the tube to the midline, give you a local anaesthetic injection. That's to the skin and to the tube. That lasts about 5 seconds. With a heat device, we just open the skin. We block off that tube, and we'll let that side go back. We then have a nick in the midline that we're left with. If it's dry, even if it opens a little bit, we just leave it alone to scab over. OK. If it's oozing from the edge, we'll put a dissolving stitch or 2 in, and they'll just drop out after about 10 days, 2 weeks. And we want you to rest up for a couple of days, take it really easy. And for the rest of a week, no heavy lifting, charging around 5-a-side, anything like that.
OK.
So what's your job?
I work for Yorkshire Water, lift heavy chambers and go under the ground.
You need like a note. Though,
I'd need a
just to-
note to say that to my...
Right, OK. We can give you a note for that.
Can I be there while it gets done or no?
No.
No.
I really want to be.
We generally ask you to wait in the waiting area, yeah, if that's OK. You're happy with the consent?
Yeah, that's fine.
You were there when I
I
give
think
birth.
it'll just wind him up.
I know, yeah. But you were there when I give birth, so...
Yeah, and I supported you through it. I didn't laugh at you.
I didn't feel supported.
Yes, you did. You said afterwards that I was very good.
All right.
Right, we're going to let you go out to the waiting area, Kim, and we'll get Luke's gear on, or gear off, should we say?
And there we go.
Enjoy yourself.
Yeah.
Yeah.
See you later.
So if you just have a sit and wait
I've had a shower last night.
About 20-25 minutes.
All right,
All
no
right.
worries.
OK, what I want you to do now is to take all your things off and then just put your arms forward into the gown, but don't fasten it up.
Right, yeah.
OK. And then just come and have a lie back on here. Is that OK?
Yeah, yeah. Ready when you are.
There you go, and I'll just raise the bed up.
So we're just going to examine you first.
Yeah, OK.
And then just relax as best you can. Is that just a little bit of catching that you feel?
Right, Mr. Wynne, I think I'm seeing you for something on your scalp.
Lump just there.
Right, just a bit warm and wet.
Okay.
Right, Dom, this cyst on your neck, how are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Oh, yeah.
Nice and still for me. A little scratch.
Tell me if this feels sharp.
A little bit deeper, but nice and still.
I bloody hate needles.
I've not met a cyst yet that I've been beaten by.
There are millions of sperm, and we've got to get that down to none.
You need to have had 24 ejaculations before producing your first sample for testing.
I'm going to be busy.
Yeah, I've got 4 kids as well. Do you want me to say it gets easier?
Please, yeah.
Yeah, it gets easier. Do you want the truth?
It doesn't. It gets harder as they get older. That's what I've heard.
Yeah, get more earache as you get older.
How many of these do you do a day then?
Yeah, we'll do 5 in a session in the morning or 5 in the afternoon. Can't do it all the time. The whole of Bradford would be sterile, wouldn't it? Can you imagine? That's just quite a nice variety for me as well as GP. Bit warm and wet. Okay. Just washing you down now. You okay? Okay, keep nice and still for me. Little scratch. You're doing fine, well done. Once you get the anaesthetic in, it all just calms down. A little bit deeper, just bear with this. Well done, that's great. Imagine how bad it'd be if Kim was in here.
She would be loving this.
She would be laughing her head off, wouldn't she?
She'll be out there now messaging all her friends.
Just bear with this while I just put this little clip on. Well done. Well done. How does that feel?
A little bit better.
Yeah? When I press you there, is it okay?
Yeah, it's fine. I don't feel up.
I think that's the worst bit over with.
Good.
Right, we're moving on to the right side now.
Okay.
This is where you'll feel is just getting the tube into place. So again, just bear with us again.
Okay.
You're doing great.
Thank you.
Well done.
You all right?
That's great.
Yeah.
It's another local anaesthetic injection.
It's fine.
And again, just bear with this, and then once that kicks in, it'll all just calm down.
Yeah. Worse than childbirth, this.
I dare you to tell her.
I've got to live with her, so I think I'll keep that between us.
She would kill you. Well, we are finished, and it's all gone very well.
Good.
So just wait where you are. Now, most people, you want to pull your pants? Yeah. Don't jump off because you're a bit high up. Yeah. Most people, well, about half need nothing. The other half will take paracetamol. Yeah. Occasional people use something like a cocodamol or something like that. Yeah. But usually you're fine. Yeah. Because you're resting up as well, aren't you?
Yeah. Well, I hope so.
Yeah.
Maybe she lets me.
Give us your gown. That's fine. Feel okay?
Yeah, feel fine.
Great. Well done. Thank you, Whitney.
Are you done?
Yeah.
Well done.
See ya.
Let's see what she's like when we go out.
She'll be laughing away.
Come in. Hiya. Hello.
Hiya.
Take a seat. There's room for all of you. Hi. Who's this lady?
Nana.
Are you Nana? God, you don't look old enough to be a Nana.
I get all the time.
You're Chelsea's mum.
Yeah.
Wow.
She's my youngest.
Right. Who am I doing? Alfie. Right. Tell me all about it.
He went swimming. He's got swimming lessons.
Yeah.
He did them for a full week. He's been non-complaining that his ears are hurting. He's been sick. He's got blood from his ear. He's been screaming. So I brought him here, and they said he had fluid on his ear, and they don't know if it might turn into an ear infection.
Right.
So I've left it, and then it just got worse, and he was complaining. I called 111.
Yeah.
And then I phoned health visitor, and then I just left it because he seemed to be. He didn't seem to complain. Yeah. And then every time I give him a bath, he's like, my ears are.
Right. Let's have a look at these ears.
Stand up.
Come here. Let's have a look at you. You've got a lovely shirt on. You've got some cars, haven't you?
He just is.
Is it one particular ear or both?
It's both of them. Settled for like a day or something, then he just kept, my ears hurting, and I was like, let's keep an eye on how you go.
That's really good, aren't you? Clever.
Because he's had it for so long, I just like to see how he goes first.
Yeah. And he's obviously, if he's under hospital, if he's got grommets in.
Yeah.
Yeah. When did he last grow?
He went to see his surgeon a few months ago, and they said that if it carries on, then Bradford will put grommets in, but the grommets have caused the blood clot in his ear.
Right, now then. There's no Innis canal now. Now today, they're dry inside. There's no gungy. There's nothing wet at all. I can press round them. When do you next go into hospital?
A year.
At the moment, it's nice and cool. There's no gunge. There's no bulging of his eardrum. So it's really... There's no real reason for me to give him any antibiotics or anything.
No, yeah.
Unless there were anything serious to do.
Yeah, that's fine, no worries. And then do you know what he said? He laid me down and he says, right, I'm just going to clean you down now.
What did he clean?
So I was like, down there, and he had like hot water and he was like fixing it up and then rubbing me.
What? Rubbing what?
What do you think?
Did you?
Yeah. Well, she was in the room watching, so I'm just like, so I said, do what I said to her. How did you get into this line of work?
Mrs. Varner Cowley? Mrs. Cowley, you were due to see Dr. Crampton, but she's stuck with a... Not stuck, she's managing an emergency. Are you OK to see me instead?
Yes,
I'm Dr. Khan. OK, come and sit down.
Thank you very much.
Right, so I'm Dr. Khan. How are you?
Yesterday, people kept saying to me, what's up with your eye? I didn't know. During the night, this part was really hurting because I sleep on that side.
Yeah.
And it's burning.
OK. Any problem with the vision out of that eye? Does it feel the
Not
same?
that I notice, really. And I think it's watering, but it isn't.
Let's have a look. Do you mind if we just take the glasses off? I'm just going to have a closer look at it. It is very red, isn't it?
Yeah.
OK, so if you look up at the ceiling for me, and just down at the floor, and then up again at the ceiling. OK, and I'm just going to do some tests on your eye. If you just follow my finger with your eyes only.
Yeah.
Any pain in that eye when you're looking over to that side?
It's just burning.
Burning,
not
yeah.
any other... Yeah, same.
OK. Right, if you just put your glasses back on, and then if you just cover your good eye with that side, what does your vision feel like there?
It is a bit blurred compared to normal.
OK, I just want you to keep looking at me. When I move my fingers, I want you to say yes. OK. We're going to try the same on the other eye, so let's do that. And then look at me again. When I move my fingers, say yes.
Yeah, I can see them now.
When you've got pain around the eye or any burning, it suggests that the bleeding is going from the surface of the eye but to behind the eye as well and inside of the eye. That can cause pressure to go up inside of the eyeball because the eyeball is a nice kind of ball and it's full already. There's no room for anything else.
No.
And if there's any bleeding, extra fluid inside of there, then it starts to raise the pressure and that can really cause problems with your vision.
Yeah.
The pressure is already getting to a point that it's damaging the nerve in the back of the eye. So we need to get you seen urgently today by the eye specialist.
Right, Ashley, are you getting out of this pram because it's your turn to be seen next, sweetheart?
Oh, my God.
That's a copy of your letter, but just to show you, but I will refer you.
That's fine.
Come on, which one do you want, where do you want to sit? Are you going to come and stand in front of me? Hello, beauty. How are you? Right.
She's had a cough for quite a while.
Yeah.
She's spluttering. She's got a sore throat.
Right.
But it's not... The cough doesn't seem to be going.
And Debbie, put this in your ear.
She's also got diarrhoea as well.
Hey, mate, come here, Nanny.
Come here, sweet.
Look, I don't want Nanny's phone. Here.
So good girl. Can you open your mouth really wide for Daddy? Really wide, open wide. Oh, are you clever?
I go back to school next week and I don't want her to say, oh, my chest hurts, or she's wheezing. I was like, no, it's not happening.
Stand here, then your mum and your nana can see you. So she's breathing beautifully.
Yeah.
Nice and calm, no pulling in. Her chest is lovely and clear. She's not pulling in or anything. She's got no glands. Her temperature's 37.5, which isn't really a temperature, but it's just up a right little bit.
Yeah.
And her throat's a little bit on the red side.
Right.
So that in line with a runny nose and a little bit of diarrhoea makes me think she's got a viral illness.
Right.
That will settle on its own. Plenty to drink. Calpol, if she's hot, might spread to these two. That's the problem.
It's fine.
You're beautiful, aren't you? Eh? Are you looking forward to seeing your friends again? At school? Is he going to school?
Yeah, reception.
Oh, you won't know what to do? Yeah. Alfie, have you got a uniform?
Yeah.
Have you got a uniform?
You look very cute in it, don't
I
you?
bet you look very cute in it. I don't believe you. I don't think there's aught wrong with your blooming hearing there. Are you doing a good job? Are you proud of her?
I'm very proud of
Yeah.
her. I've been a bit stressed over the last few days because I've been at my house for the last couple of days having a bit of quality time with Nanny.
Listen, as well, you worry about your children all the time, but try and look at them and think, God, haven't I done well? They're great. You enjoy that time when they're at your mum's and when they're at school, because you won't get that time back. It's lovely.
I can't wait till they
You're
go
going
to
to say
school.
bye-bye?
Bye, kids.
Thank you.
Bye-bye, love.
I felt better, but this morning, well, I woke up a few times during the night and I had this pain down the side, burning, and I thought, well...
I'm just a bit concerned you might have this other condition called an acute glaucoma, where all of a sudden the pressure raises in the back of the eye and causes that nerve problem. Nobody really knows why it happens. There's lots of different theories, but we don't know why.
Like
ladies are more prone to it, unfortunately. Let me ring the eye hospital. We'll get you an appointment there. They'll see you today. Oh, I'm so glad you came today, because any kind of pressure in the back of the eye can lead to permanent sight loss if the nerve gets damaged really badly.
I've never had anything like it. And that's my best eye.
That's your best eye, so we need to keep it your best eye.
Yeah.
You're the most unwell patient I've seen today. I know you don't feel unwell, but this is a really serious condition, so we've got to get you seen by the eye doctors ASAP. Hi, my name's Dr. Khan. I'm calling from the Ridge Medical Practice. I've got a lady who's 74 years old. She's coming with an acutely painful left eye. It started yesterday, red bloodshot. She's got painful eye movements, pain inside of the eye and above the eye, and a burning sensation on the surface of the eye. On examination, the pupil on that side is sluggish to respond to light, and she's lost her visual fields on that side as well. Pretty worried about her, to be honest. Will it be today, though, her appointment? I'm really reluctant to let her go home, because even while she's sitting here, her vision is deteriorating. We need to get you seen today. I won't take no for an answer, don't worry. If it's all right, I'd rather her not leave the building until I've heard from you, because I need her seen today. Yeah, so will you call me on my mobile the minute he's free? Yeah, all right, thanks very much. Cheers, bye-bye-bye. Mrs. Cowley, I'm going to have to hold you prisoner here.
Oh.
No, the eye doctors are in theatre with another patient.
Yeah.
I don't want you to go because I'm worried that minute by minute your vision will get less and less.
Yeah.
Like, my eyes are burning.
There's discharge from the eyes. When he wakes up, they're literally glued shut.
So you get a little, like a mist.
The lashes, they are a bit sticky there.
Did those drops help that I gave you?
Stare in the middle of that door for me, David. You're going for your eyes tested, are you?
Well, I want to do.
Regarding the eyes, we see that there is some infection there. Okay.
Well, these are good enough. Look at these. Look like I'm in Top Gun.
Hello, love. Listen, I'm at doctor's. He's keeping me prisoner. He won't let me go. It's dangerous. It's very urgent. OK.
Mrs. Cowley?
Doctor's called me. I'll give you Jeffrey. I was just talking to my sister.
I'm glad you're still smiling, Mrs. Cowley. Come on.
Well, there's no point crying,
No
is it?
point crying, it's true.
Thank you.
Sit down. So, the eye doctor's rung me back. He's equally worried about you. He's in theatre all morning today. He's booked you into his clinic this afternoon at 3:30.
Where is this at?
At the BRI. I'll write it down on here. They're going to see you urgently, and if you take all of this with you, it's got the letter that I've written.
Right. Have you done all that already?
I have. Very organised.
I'm watching you. I thought...
So just take an overnight bag in case they decide to keep you in hospital.
Okay.
So take all of that with you, and then once everything's fine, will you come back and tell me how it
I
went?
will.
Yeah, I'll be interested to know.
Thank you very, very much.
My pleasure.
Thank you very much.
My pleasure. Oh, 2. We're very exotic.
Us Italians
in this place.
like kissing. Thank you
All
very
right,
much.
cheers.
Bye-bye.
Just go through there, Mrs. Cowley.
I want to go to the toilet.
Oh, fair. I'll allow it.
Morning. Come on in, have a seat. Right, I'm Dr. Caris. This is Caroline with us today.
How do you do?
All right, thank you. Right, something on your back, is that right?
Yeah, I've got a cyst.
Yeah. Tell us a bit about it.
I've had it for a couple of years. It does fill up, and then when you lean back on a chair, it's tender.
Does it leak and discharge?
Well, I end up getting wife to squeeze it. Yeah.
And then you get sort of cottage cheesy
That's
type
right,
stuff
yes,
out.
it stinks,
yeah.
yes.
Smelly, isn't it? Right.
Yeah.
And you're keen to have it removed?
Well, I've had it a couple of years. I want to get shut of it now.
Right, would it be all right to have a quick look
Yeah.
and an examination, and then we can have a chat about it? Do you mind if we just lift this up? This is it in the middle, isn't it?
Yeah.
Is it all right if I just have a gentle examination? And when was the last time it leaked?
About 3-4 months ago.
OK, so a good while back. You can see the little head on it, can't you? Yeah. OK, that's fine. Right, thank you. So, these things are very, very common. Most people, at some point in their lives, will get one of these somewhere on the body. The scalp and the back are the two most common areas, and they're just a blocked oil gland, and we've got oil glands all over our body to keep us waterproof. So what would involve is numb it with an injection. That does sting a touch, OK, for about 10-15 seconds. Cut over the top of it, shell it out like a pea in the pod, and then put some stitches in. OK. Grand. Right, you don't mind us if we just lift this right up? Perfect, yeah. So the injection does smart a touch, I'm afraid.
I gathered it would do.
But only for 15 seconds max, probably. Right, are you set? Here we go. 3, 2, 1. Touch more. Right, just give that a bit of time to take effect.
Well, that wasn't as bad as what you were making out.
Yeah, I wondered sometimes if I do overplay it a little bit. Any of that sharp? How's that?
Yeah, I think you're all right with that.
Not sharp. So how long have you had this one for?
3 years, I think. Maybe a little bit longer.
Hello there.
Hiya.
Come and take a seat, sir. Mark Russell.
Yeah.
What can I do for you today?
I've got a recurring bad back. It went away when I got some painkillers and some anti-inflammatories, but it's just come back again. It's come back in force this time. Because my legs, I've got pins and needles in my arms and pins and needles in my feet.
So tell me more about your back pain. When did it start?
About 4 or 5 days ago. I had to sleep for 4 days.
Right, because of your back pain?
Because of my back pain.
We just have a feel of your back, so if you take your coat off for me, please. How does that feel when I'm pressing you?
That's okay then. Just when you get to there.
Right. So if you just lie here on the couch for me. Right, I'm going to lift your leg up. What's happening when I'm lifting your leg up?
It's pulling up back.
Both sides?
Yeah.
Right, let's bring you back up. You all right? What's happening to your breathing?
Just getting right tight.
You suffer from asthma normally, don't you? Have you been having your inhalers? Yeah? You having any chest pains?
Just this, see.
So just come and take a seat. What do you do for a living?
I don't work.
Right.
I'm permanently sick. Take me out.
Right. How's your breathing now?
Still the same.
Same?
Same, yeah.
Let's put this on your finger. We need to be clear on this. How's your breathing now? Because if your breathing's not getting better, then I'm going to have to send you to hospital. Because I don't know what's causing you to be short of breath so quickly. Do you drink alcohol, Mark?
Yeah.
How much do you drink?
Just 4 cans, that's all I have.
4 cans a day?
Every so often, they don't have them all the time.
Do you use any street drugs at all?
Yeah, I do.
Right, what do you...
Speed.
Speed, right. When was the last time you had some?
About a day and a half ago.
We need to be very clear on this, Mark.
Yeah.
Yeah? If your breathing is off, And if it's become off very quickly, that means I'm going to have to send you to hospital. So you need to tell me clearly, do you think your breathing is an issue for you?
Yeah.
Yeah? Okay. Would you be happy if I called an ambulance for you?
Yeah.
Yeah?
I'm better off. I don't feel well at all.
Right. Give him a call. Oh, ambulance, please.
Key to it is getting all the lining out to try and stop it coming back. It's just what I'm doing now.
Well, I don't want you coming back, but...
No. They're not much fun, are they?
No, no, no.
You okay there?
Yeah, fine.
Good, it's coming out nicely in bits and pieces, which is what I was expecting. I think we've got all the lining out now. Good. Couple of little absorbable stitches and then you'll be home in time for breakfast. Second breakfast.
No, no.
Do you not have a second breakfast?
No, no, no.
I try and have a second breakfast whenever I can.
A cup of coffee.
My second breakfast usually starts before I go to bed at night.
Non-stop eater.
Unfortunately.
A grazer.
I like to graze as well.
Yeah, I just can't. I've got no willpower when it comes to food.
What would your ideal second breakfast be?
Bacon butty with an egg, a runny egg, brown sauce.
If it goes in a tea cake, I'll eat it.
So these stitches absorb from the inside out.
Okay.
So the last thing that goes is the knot. It usually takes about 3 or 4 weeks. Tiny little nick, but we've managed to get it all out through a little, it's like keyhole surgery almost.
That's fine.
We're not going to send anything off to the lab to get analysed because it all just come out in piecemeal and it certainly was a little cyst.
Yeah.
We'll put a little dressing on now, which he just asks you to leave on for 24 hours and keep it dry for that period of time. OK? Any questions you want to ask?
No, I'm fine with that.
Grand. Right, we'll just lower you down and you can sort yourself out, get your cup of coffee.
Ooh.
She does a good breakfast upstairs, actually. There's a little cafe upstairs. OK?
Right, yeah, thanks very much.
All right, we'll leave you to it then.
Cheers,
Okay.
thank you.
See you later. Bye-bye.
Let me put this on and check your blood pressure as well. Let's put this on your arm. This arm. I can smell a little bit of cannabis on you. Do you have any cannabis at all?
I have had.
When did you have it?
Last night.
Last night. How much did you have?
Not a right lot.
Right, what's not a right lot?
About 1 cigarette and that's it.
A cigarette?
Yeah.
I can smoke quite a bit. Your blood pressure is perfectly normal. How long have you been smoking for?
I haven't been smoking, don't smoke.
And our speed?
I've been doing that for the last 25 years.
Mm-hmm. Have you ever thought of cutting down at all?
I go to a mental health
Yeah,
place.
I know. I've seen your notes, yeah.
It caused me a mental breakdown.
Mm.
I've got much on my mind and everything. I've tried loads of times to stop, and I just can't.
You told me a little bit about what had happened with this on your eye.
Yes.
Yeah, skin cancer.
It just swells up and it's as sore and as tender as anything.
Tell me what happened with your skin. All of a sudden, it's like you just get up one morning and what's happened?
We'll have a look at both these areas.
They don't know how far it's gone inside the eye.
Yes.
Has it helped as cream?
And I couldn't take my cap off and it stuck to my cap and it all came off in my cap. And it's left a hole.
Ah.
He's got a bit of a rash and he's itchy, dry. Any rash anywhere else?
It's a bit unusual.
Mandy, that's me, innit?
You're ticklish, aren't you?
Come on in, eh? Have a couple of seats. Hiya.
I won't take that seat.
No, you can if you want. We can switch around. Right. What's going on?
I have a lump here that I'm advised to have it looked at.
OK.
Sometimes it itches like flipping crazy.
Does it?
Yeah.
And how long have you had it for, would you say?
I'd like to blame Brexit, but I've had it about 10, 15 years, something like that.
Yeah, it has grown a little.
Started as what I thought was a spot, and then it just developed into this lump.
Does it ever bleed?
On one occasion it has bled, yeah. That could be when I was trying to get rid of it by rubbing it a bit and washing it extra. And...
Right, OK, but it doesn't bleed by itself?
No.
No, OK. And have you tried to squeeze it and get rid of it and things, or some people are tempted to poke and prod and
not particularly.
Get the Stanley knife out and things like that? No, you're not doing that? No, good.
No, the Stanley knife, no.
Excellent. And have you ever had any skin problems like this in the past?
I have had a cyst removed from my chest, actually, which...
Oh, did you?
I had that removed because of the smell. The smell permeated.
I know,
and it was a terrible smell. And I watched him dig it out, and it was a yellow pus, and it was terrible.
They're not much. They're not nice to have those, are they? Would it be all right to have a closer look and a gentle examination and things? Right. I'm just going to put a bit of this jelly on. You don't mind if I just...
No, help yourself.
You don't mind? Is it sore to touch?
No.
Right, and this is just a magnifier with a little bit of jelly, which gives us a better idea. OK, thank you very much. Your doctor was concerned it might be a type of skin cancer. I don't think it is. I think it's an overgrowth of one of the layers of the skin, like a type of mole, if you like.
Right.
We've had it a very long time, and it's very, very slow growing, and skin cancers tend to grow a little bit more quickly, but I don't think it is when you look at it down the microscope. And I don't think we would be able to remove this on the NHS, unfortunately, because it would be deemed cosmetic. But if you did want it removed, I think there are options within the private sector.
Not at the moment, no. I'll put up with the itching.
Why does it get itchy? Sometimes it can just get a little bit inflamed. Some of the cells that are in there can get inflamed. And once we get an itchy patch, we often scratch it without knowing, and then that makes it a bit more itchy and things. So sometimes a little bit of moisturiser, if it gets a bit itchy, might just settle it down. Is that all right?
That's fine, yeah. Fine.
Great. We'll leave you to it then. Thanks for coming in.
Right.
All right. Have a good day. All right. See you later.
Bye.
OK, bye-bye. Obviously, if things do change in the future, please do get checked out, because things can change. But here and now, I'm not worried.
OK, thanks
all right.
very much.
See you later. Bye-bye.
How's your breathing now? Better? Calm down, isn't it? Yeah.
Panic attacks as well.
All right there, guys. All right there. Right, we have Mark 51. He came in for a back pain, and it seems like having a panic attack, it looked like. So his heart rate went quite high and became very short of breath. He has been taking some drugs. He's been smoking quite heavily last night, by the seams of it. His heart seems to be calming down now.
What was his rate?
So he went up to 124.
124?
Yeah. Came back
Is it just weed you've been smoking, Matt? Marijuana?
I don't smoke.
All right.
I was sat in the room with them.
Well, they were smoking.
Yeah,
What were they smoking?
Marijuana.
Yeah, it smelled like quite, yeah.
I've been taking amphetamine as well.
You still got a pain now?
Yeah, just a bit.
I'll just do this quick ECG, make sure nothing's going on with your heart, and then we'll get you to ambulance, all right, with it? Just means putting these stickers on your chest, all right? I'll lift up that, is that all right?
I've lost loads of weight since the last 2 months anyway. I've just been so stressed out and depressed and not eating properly. And...
Well, since I've seen braces.
I'm fed up with my pants falling down. And I've got a flat cap as well.
Oh, yeah. All you need is a whippet.
I've got one.
You got a whippet? Right, keep really nice and still, all right? Just for 2 seconds, no talking. Yeah, apart from being a bit fast, it looks all right, Matt.
All right.
All right. Any heart problems in the family? Or?
Yeah, my mum.
Your mum?
Mum died of heart attacks.
Was she over 60?
Yeah.
Yeah. Having difficulty breathing when you came in? Yeah. Pins and needles in your hands, anything like that?
In my legs.
In your legs?
And in my hands.
What about in your face?
In the side of my face.
Yeah. Sounds like a panic attack. We'll get you checked out. Right, Marky, you want to get your stuff ready?
Thank you very much. All right, Mark, we'll see you once you're out the hospital.
Yeah.
All right.
Right, thanks a lot.
All right.
I smell something right weird. Have I stepped in something? Can you smell something?
Is it a bad smell?
Mmm. It's not me, is it?
No, you smell nice.
Come on. Come on, sit down.
Thank you.
How you been?
Oh, not too bad, not too bad.
Good.
I got your text this morning. What's been going on?
So we'll have a think about things, because last time you came in, you said that you'd had this fuzzy feeling in your head, really. And you were worried about it
Non-compass mentis, I call it.
Well, yeah, it's a posh word for it. You were worried it might be your medication.
That's right.
But actually, when we looked through your notes, you'd thought that before for other medication, and we'd stopped them, and the symptoms were still there.
Right.
So we did some blood tests, which, to be fair, have all come back clear, so all normal. But it leaves us with the question of why are you having this feeling?
Okay.
How long do you think you've had this fuzzy, woozy feeling for?
2 or 3 months at least, yeah.
And then tell me exactly what it feels like when it happens.
Well, it's just, you know, you've lost track of everything. You're walking down the garden path from the greenhouse to the house, and all of a sudden you just go like that. You know, what was that about? You just do that bit of a stagger. Yeah. And I thought, well, you know, I haven't been drinking.
Is your speech ever affected when it happens?
No.
What about your arms or your legs? Do they feel weak ever when it happens?
Pins and needles, yes.
OK. Tell me a bit more about that.
From that point there, and here, I can feel it coming now.
You can, yeah.
All down this side here. But every now and again, I go into cramp.
That might be a separate problem as well, but we'll have a think about that.
Blimey, how many problems have we got?
Oh, yeah, well, you've only got 10 minutes. You know, use them wisely. No, I'm only joking. Do you ever get forgetful at all?
Yeah.
You do. We have to think about what is causing this. Is it just normal ageing, and as we get older, we do become a little bit forgetful?
Oh, yeah, totally.
Or is it something more than that? I don't think it's anything like Alzheimer's dementia or anything like that. The other thing that it could be is something called vascular dementia, and it's not the same, but what it means is you might be having, we don't know for sure, tiny little strokes.
Yeah, I had thought about that, but I mean, you just don't know, do you?
You just don't know, but there is one way to find out.
Ah, right. Well, I'm good for that.
To get a scan of your head and see what's going on the inside, and then we can go through the results of that together.
Right, OK.
Does that sound fair to you?
I'm all for it. You know, I keep pulling the leg of a lot of people. I say I'm 93. I want to try and get there if I can.
We'll work on that together, shall we?
Thank you. Bye. All the best. Bye-bye now.
You too. Bye.
Bye.
All right, Mark, so I'll see you, next Monday, yeah? 12 o'clock, yeah, here.
Thank you very much indeed again.
Thank you again.
Okay.